Yes, hello friend. How are you doing? Allow me today to share with you about brucellosis. Yeah, basically we shall do an introductory part of it, and we shall talk about, of course, the definition. We shall look at the signs and symptoms. We shall get at the treatment and prevention. We've got to know about the causes of brucellosis, the risk factors of brucellosis. Yes, we shall look at the signs and symptoms, not forgetting the complications. All will be in today's tutorial. So please, you can listen to it up to the end. We shall know how to diagnose the diagnosis and test for brucellosis. I will be giving you those tests that we can do, and like I say, the treatment, the prevention, and things of the like. So let's get started. Okay. Yeah, brucellosis is our case study today, and brucellosis is a disease, or I should say, it's an infectious disease caused by a type of bacteria called Brucella. So commonly, right here in the country, many people are told that you have Brucella. Yeah, but Brucella is actually the bacteria. That's the name. The type of bacteria that causes brucellosis. So that bacteria, Brucella, can be spread from animals to humans, and there are several different strains of Brucella bacteria. Some types are seen in cows, other types occur in dogs, others in pigs, in sheep, in goats, and even in camels. And if you're staying very close to those animals and you're very much associated maybe with their products, and you stay in close connection with them, so you're a risk factor, I should honestly say. And well, like I just mentioned, the four, those when there are species, like to date there are 8 species that have been identified, and they are named primarily to be the source animal or features of infection. And of these, there are 4 that have moderate to significant human pathogenicity. Yes, of course, like I told you, there are very many, there are several traits there, I mean, strains of Brucella bacteria, but there are these particular 4 that I want us to focus about, because they are the ones that have got, in relation to human beings, they have got moderate to significant human pathogenicity. So there's what we call Brucella melitensis. That one is from sheep. Brucella melitensis, that one is from sheep, and it has the highest pathogenicity. I'm talking about human pathogenicity. Then there is Brucella sus. You could say Brucella sus, but to get the clear pronunciation, or just to come out with the spelling, Brucella sus, that is from pigs. It has a high pathogenicity. Okay. Then there is Brucella abortus. That one is from cattle, and it has got moderate. It has got moderate pathogenicity. Still talking about human pathogenicity. Then we have Brucella canis. For that one is from dogs. If you're very close to dogs, and that one has moderate pathogenicity. Just to do a little bit flashback of all that, we have this Brucella melitensis from sheep. That one has the highest pathogenicity. We have Brucella sus, that is from pigs, and it has moderate pathogenicity. So we have Brucella abortus from cattle. Uh, it has moderate pathogenicity. Then Brucella canis from dogs, it has also moderate pathogenicity. Hope you got that. Brucellosis from pigs has high pathogenicity, of course. So now, I won't go so much into the history of brucellosis, but uh, basically, brucellosis is a disease that is thought to have existed since ancient times, and as it was first described more than 2,000 years ago by the Romans and Hippocrates. And we won't go so much into the details and history of the disease. We want to go to much more important things. So, what causes brucellosis? We are now switching to the causes. Okay, so brucellosis is in humans occurs when a person comes into contact with an animal or animal product that is infected with the Brucella bacteria. Yes, and very rarely the bacteria may spread from person to person. That's very rare. To have the bacteria spread from one infected person to another, that's really, it is possible, but honestly, it's very, very rare. And breastfeeding moms with brucellosis may possibly pass the bacteria to their baby. Yes, that's possible. And brucella may also be spread through sexual contact. So it is very, very possible. So though in rare cases does it happen to have a mother spread the brucella to the baby, or even to spread the brucella through the sexual contact from person to person. These are rare occasions, but it's very possible. Okay, and there are also possible ways how the bacteria can get to enter into the body. And let me just give you some examples here. For example, through a cut or is scratching the skin, the bacteria brucella can enter into the skin once you have a cut or a scratch. So you have to be very, very careful. And the other way how a bacteria can enter into the body is when you breathe in contaminated air. Yes, when you breathe in this contaminated air with the bacteria, you can, though this is very rare, I repeat, this is something very rare, and but it's possible. Okay. Then the other way how bacteria can enter into the body is when you eat or drink something contaminated with the bacteria brucella. For example, unpasteurized milk or undercooked meat. So please get serious. Make sure you do not eat or drink things that are contaminated with the virus, especially milk that is unpasteurized, and also meat that is undercooked. Yes, you might have a big appetite for meat, and that's okay, but please, you don't have to eat half cooked meat or call it undercooked meat. Please get serious. To talk about the risk factors of brucellosis, uh, people who eat, of course, I've talked about this and among the causes. But if you know you're there and you're eating or you're drinking unpasteurized dairy products, for example, from cows, could be from goats or any other animals that are infected with the bacteria, so you're a risk factor, no doubt, you're a risk factor. And also, if you're eating other unpasteurized cheeses, called village cheeses, these come from high risk regions, including the Mediterranean. So you have to really be very much careful. You're a risk factor if you belong to that category. The other risk factor is people who are traveling to areas where brucella is common. So if you know a place that is really so much infected with brucella and you're traveling there, so you are a risk factor. You've got to be very careful where you're traveling and where you're going. Okay, so it's important you can make some research sometimes for your health benefit and safety. In the medical field, we say health first, safety first. So take great care. Health is wealth. Um, Another risk factor is working in a meat processing plant or a slaughterhouse. In Luganda, we call them, those abattoirs, we call them lufulas in Luganda. Yeah, we call them lufulas. So if you're working in an abattoir, call it a slaughterhouse, maybe in that industry, that meat processing plant, you are absolutely a risk factor. You have to be very careful. Also, working in a farm makes you a risk factor. Yes, probably you're a herdsman, you're a milkman, you're rearing cattle, you're keeping those animals, you're staying very close to them. So because you're exposed to them, no doubt you're a risk factor. Yeah, let me pause there with the risk factors and the causes of brucellosis. Allow me to switch to the signs and symptoms. When do you get to know that really I could be having brucellosis, and so you really have to go and take a medical checkup? So symptoms in humans are similar to having the flu, and uh, the symptoms may include these that I'm going to mention right here. Firstly, continuous or intermittent fever. Yes, if you have continuous or even intermittent fever, uh, that could be a sign and symptom for brucellosis. The other symptom is headache. Yes, another one is weakness. General body weakness. The other one is profuse sweats. If you experience those profuse sweats, the chills, the joint pains, the aches, you feel pains, joint pains, uh, weight loss, you find yourself losing weight, start to thin up. The infection can affect the liver, it can affect the spleen, and it may last for days or months, and sometimes it can last for a year or even more if not treated. So you really have to take this disease very, very much serious. Still about the signs and symptoms, there could be joint complications in the joints, and involvement of the testis and epididymis. Uh, so when I talk about this, I mean storage tubes for sperm that are on top of the testis. These actually these are common. These are common. You have to be very careful. And recovery is usual, but relapses can occur. You get it? So meaning you can recover, but then this can relapse, or it can reoccur, it can arise. So you really have is a serious disease, and you don't have to take it for granted. Seek medical attention as soon as possible when you see those signs and symptoms. Uh, Still about the signs and symptoms, death can occur from inflammation of the lining of the heart, and that is the endocarditis. But this is very rare, of course. It's very rare. Allow me to now briefly talk about the complications of brucellosis. Of course, like every other disease, they can have complications, and for brucellosis, when we talk about the complications, if treatment isn't successful, brucellosis can cause several complications, and some of them I'm going to mention here. To start with, encephalitis. Encephalitis is a complication for brucellosis, and what do I mean by encephalitis? This is inflammation of the brain. Your brain gets inflamed, and that is called encephalitis. The other complication is lesions on the bones and joints. Yes, you can get lesions on your joints and the bones. In case the treatment for brucellosis is not successful, that is another complication that can occur. The other complication is arthritis. Arthritis. Okay. Another complication is endocarditis. So when I talk about endocarditis, I'm referring to infection of the heart's inner lining. Yes, once your heart's inner lining is infected, or it gets infected, that is called endocarditis, and that's a complication of brucellosis. And complications can come to the membranes around your brain, and when the membranes around your brain get inflamed, or when they get inflammation, we call that is meningitis. So in other words, meningitis is another serious complication of brucellosis. So now, how do we come to diagnose and test for the disease brucellosis? How do we diagnose that? So there are several tests that we can do. When you go to hospital for medical attention, some of the tests they can do blood culture, they can do urine culture, they can do bone marrow culture, uh, they can do, the doctors can do CSF testing, and that is cerebral spinal fluid testing, and they can do testing for antibodies to brucellosis. Yes, and besides that, there are other imaging studies and procedures that may be performed. Of course, this is done depending on the individual's signs and symptoms. Depending on the signs and symptoms that the patient has, uh, the test can be done. And to mention some of these, we can do the CT scan, we can do the MRI scan, the X-ray can be done. They can do the ultrasound. There's what we call the lumbar puncture. The lumbar puncture, that is to do the spinal tap. There is joint aspiration. The ECG can be done. That is the electrocardiogram. But like I told you earlier, these imaging studies, these procedures, they are performed, but they are performed depending on the signs and symptoms of the patient. Okay, now let's get straight to the treatment. Yes, the treatment of brucellosis, and there are things you have to take serious. Um, the cornerstone of treatment for brucellosis is antibiotics. That is one thing to note. Very, very much important. The cornerstone. If you are treating, you're having brucellosis treated and managed very well, the cornerstone of treatment for brucellosis is antibiotics. You know, because of the high relapse rate associated with the disease, the use of a multi-drug, I mean using two or more antibiotic regimen is recommended. Yes, so in other words, I mean, because the relapse rate of this disease is so high, and in other words, it can repeat, it can rehappen, it can reoccur, and because of that, we consider using a multi drug. We consider using uh, two or more two or more antibiotics, using a regimen that is maybe a combination, having a combination of drugs, a multi-drug. That's what I'm trying to mean. It is recommended, so we recommend that. And the antimicrobials that are uh, commonly used or mostly used, they are these ones that I'm telling you today. So there is doxycycline, and there's that brand name, you can call it vimbramycin. So doxycycline is a good drug for that. So doxycycline, streptomycin, rifampin, where we have that brand name of rifadin. There is ciprofloxacin or ofloxacin. There is gentamicin. Of course, there we have a brand name of garamycin. There is also the drug called trimethoprim sulfamethoxazole, where we have the brand names like Bactrim, Septra, and then of course we have the other antibiotic tetracycline. And dear friend, the combination of antibiotics used will vary based on disease severity. It will vary depending on age. It will vary depending on whether the patient, if a woman is pregnant or not. Let me repeat this. Combining these drugs, combining these antibiotics will vary, or it will depend on how severe the disease is. It will also depend on the age of the patient, and it will also depend on whether the patient is pregnant or not pregnant. That is now assuming if the patient is a woman. Now, allow me to stop there as far as the treatment of brucellosis is concerned, and I will finish with prevention, how we really can prevent brucellosis. Number one, exclusion from work is not necessary. That is something important you have to note. So you really don't have to be excluded from work, or to terminations from work. You don't have to do away with work. You don't have to quit from work. Yeah? Take that serious. And then a vaccine is not available for use in humans. These are now things that you have to note and take them serious. I have told you that exclusion from work is not necessary. Sometimes some people will say, let me stop work. No, that is not necessary when we are talking about prevention. And then a vaccine, not this, a vaccine is not available for use in humans. So there is no vaccination for brucellosis in humans. Now, how is control best achieved? Control is best achieved by eliminating the disease in animals. So that is the best way. That is the best way that control can be achieved. If you want to do away with the disease, you have to eliminate the disease in animals, because it is these animals that we are staying very close with in our domestic areas. We are living with these animals, and they are exposing us to this. Yeah, I apologize for that noise in the background. Yeah, some band guys are passing around with their trumpets, and we cannot stop them. But we are just about to finish. But I'm glad, and I hope you're picking this very well. And still about the prevention. Let me allow them to pass. I will not compete so much with these young gentlemen. There is that noise pollution, and there is still about the prevention. You've got to avoid, if you are to prevent this brucellosis, you've got to avoid drinking raw and unpasteurized milk, and even the products. There are products that are made from raw or unpasteurized milk. We have people who really love so much. There are people who are so much in love with milk, and they end up taking this raw milk. They take those yogurts. They take the cheese. They take those products, those milk products. So these do expose you. They do expose you to the disease, brucellosis. So now you really have to avoid drinking that. Or if you're to take such things, you have to make sure they are well boiled. Okay. And then the other, still under prevention, we've got to educate farmers. So this is about sensitization. You sensitize and educate farmers, educate the abattoir workers, those people who work in the slaughterhouses, and other occupations at risk groups on how to prevent infection when handling potentially infected animal products. So people have gotten to know how best they can prevent the infection, especially when they are handling potentially infected animal products and the animals themselves. Another way of prevention is you can cover open cuts and sores with dressings. Yeah, like I told you, this can spread through the skin. Once your skin is cut or has got a scratch, a risk factor that exposes you, the bacteria can enter the skin. So as a measure of prevention, you can cover those open cuts and sores with dressings. The other way of prevention is wear gloves. Now I'm talking about the the preventive measures. Put on those preventive wears. Yeah, you can probably you can wear gloves, you can put on overalls, you can use face masks, and you can put on those things, that those protective wears when slaughtering animals, and also when you're handling animal products. So that is really so helpful, and it will do you. And yes, as we are about to finish with the prevention, you have to thoroughly wash hands and arms after handling animals or their products. Please wash your hands, yeah, of course, with soap, and take great care. And then take special care when handling animal bath products. Yes, when those animals give birth and you're handling those products, please take special care. And then lastly, I should end with this: thoroughly clean all working areas. Wherever you're working from, whatever you're doing, please clean thoroughly. Ensure a proper hygiene and sanitation, and you will be safe. Yeah, allow me to stop there. I hope you've learned something today as we were sharing about brucellosis. Yeah, thank you so much for following. Thank you for being attentive. Don't forget to subscribe to my YouTube channel for more videos that are coming up. Yeah, hit the bell. Good time.